Well, an overbite's quite common actually in the population, and probably I would say 80–90% of our patients have an overbite that's a problem. And what we mean by overbite, often there's a misconception about overbite being this way, top and bottom. It's actually that way. It's the overlapping of the teeth. And that's a problem because as you get older, those teeth will wear, and they'll wear unnaturally, and that causes problems, particularly as an adult, if you don't get it corrected. And as a young patient, as a teenager, they're actually quite easy to correct, and they're quite easy to keep perfect long term.
I think the risk with not fixing the vertical overbite, which is the actual overbite, not the protrusion of the teeth, is that it gets deeper with time, as you said, Ray, but it also, the bottom teeth start to hit up against the gums behind the top teeth, and they start to push the gums, and they get gum shrinkage or recession of the gums. And they can also cause a lot of wear behind those top teeth. And a lot of people with these deep overbites are prone to getting headaches and ringing in the ears. And when we fix the overbites, we fix the headaches as well, because that's related to the bite being locked in. And so when we fix the locking in effect, the jaw feels freer, the person feels more comfortable, they don't grind their teeth as much, and it's a terrific benefit, isn't it?
People hear of the word TMJ, I've got TMJ, I've got jaw pain, and one of the factors that can be involved in it is that overbite problem. And so correcting that can, not always, but can help with TMJ dysfunction as well.
And as you mentioned, Ray, the other aspect that people think an overbite is that, well, that's the overjet, where how much they jet over the bottom teeth, they jet past the bottom teeth. That's really important to fix. If you've got a young person, a young child who's got that overjet, it's really important to fix it. And you can fix it so easily while they're growing in the pubertal stage, so when they're 12, 13, 14 years of age. The downside is it's very sad when you see people being monitored and that isn't fixed, because then we have to recommend surgery to fix it in an adult if it's really severe, or taking out upper teeth, or doing a compromised treatment. But if we can get that child in while they're growing, it's really a piece of cake to fix, and it's so beneficial for their profile and their jaw function as well.
That's right, and that adolescent growth spurt that you're alluding to, that is the key time.
It is.
That growth spurt is when the lower jaw grows at its maximum rate for a couple of years, and that's how we correct that difference from there to there. So that overjet correction happens. It's the perfect time to do it.
It's the ideal time to do it, and a lot of people try to do things a little too early, and it's kind of sad in a way. And people often say, well, my jaw relapsed, well, what happened there? Well, they could have a growth pattern that's growing the wrong way, but often if you do that treatment too early, it's going to relapse, because the original jaw condition will re-express itself. But if you treat it, as Ray said, while they're still growing in the pubertal growth spurt, and you finish it around the time they finish growing, then there's less growth to upset the apple cart, and you end up with a better, more stable bite correction at the end of the day as well.
Absolutely.